I want to talk a little bit about what we have. There's only about 15 minutes here before they start again. So, first off, I want to talk about Dr. Lou and his intro. And if anyone knows David, you know he's a kind and heartfelt soul that is really dedicated to democratizing longevity medicine. And so, one of the things that he went through was all of the strategies to expand our universe. The longevity doctors are 500 plus doctors in 300 plus cities. So, just to give you a grasp of our group, our reach, it's massive. Longevity doctors, 500 docs plus 300 cities all over the globe. That enables us to network and care for you as a community for longevity and really to democratize longevity. Now, to the meat of the discussion today. We had three great talks this morning. One from Matt Cook, an anesthesiologist, one from a dermatology researcher, Saranya Wiles at Mayo. And it was very interesting because it's a very academic view versus Matt Cook's, which is a very clinical sort of view. And then the first one I want to talk about, though, is Len Pastrana. So Dr. Pastrana is a PharmD who is focused on exercise and athleticism and has worked for years with peptides and with his company New BioAge, scaling up longevity peptides, educating providers for well north of a decade now. So his experience is profound. And with this, one of the things that he wanted to talk about, which I thought was great, was he talked about peptides and their source. So a lot of peptides they call them natural compounds because our body makes these peptides. But in compounding and pharmaceuticals, there are little additives put into peptides. And so he wanted to make sure that everyone understood that just because it's natural doesn't mean it's natural. And so that's very important when you look at your manufacturers for peptides. It's number one. Number two, he wanted to talk about the role of traditional medications versus peptides. Peptides tend to restore our natural function, whereas medications often will jack up and hyper respond. Think of that as a great example. I think of um, sermorelin or ipamorelin, which tells our body to make our own growth hormone. So we don't get crazy super physiologic levels, whereas growth hormone injections do. And one of the problems with growth hormone, and I think of places like Cenogenics, is that giving unopposed growth hormone can increase your risk for the following: cancers, melanoma, colon polyps, and also diabetes. Whereas peptides like CJC with ipamorelin, sermorelin, or tesamorelin, which is an FDA-approved peptide, merely tell your body to make more growth hormone. And so Dr. Prestano went over that. He also talked about things that weren't peptides that people are calling peptides. And the most important one of those I think you need to understand is MK677 is not a peptide. I'll say it again. MK677 is not a peptide, but it will stimulate growth hormone production. The next thing that he talked about is peptides which mimic exercise. You don't need all 70 plus peptides in the zone. You'll do really well just with using GLP-1s and growth hormone releasing peptides. If you combine the two of them, you can get real power. And I've seen that with patients with myself. We have this suprahuman superhero protocol where we use red light, oxygen, but we also use growth hormone releasing hormones like sermorelin or CJC with IPAM and pair them with things like GLP-1s, which not only will help you burn fat, but they will also help with things like arthritis. GLP-1s help with reducing inflammation in the brain. So we're looking at a longevity pair of peptides, and Dr. Len Pastrana talked about that. He also talked about dosing and the proper time, right? We have to think about giving our peptides in a chronobiological fashion. And so we do that at Concierge Medical. And I also, on my Substack, help people educate how to chronobiologically dose these. So I think this is important. Whereas Novo, right, Novo Nordisk, instead of trying to think of chronobiological, they just say, let's jack up the dose of semaglutide. Why not? If one works, then 10 will be better. That's one of the worst. Hey, Woody, it's good to see you, man. I want to say again, the pharmaceutical brain trusts are busy jacking up doses of medication rather than nuancing and dialing in peptides at the appropriate dose and thinking about proper stacks of peptides. Why? Because they only have one product and they want to sell a higher dose of it because it'll cause you to lose more weight. Well, high dose semaglutide will also cause adverse side effects. It'll cause adverse muscle loss, and you're going to have a really big problem nuancing and tapering someone off as you jack up the dose. So we're not here to jack up the dose. And I think that's a very important message that Dr. Prastana said. Know the biology, know the pathways, understand chronobiology, and dose accordingly, using the minimal dose of peptide you need. Next up was Matt Cook. Matt Cook is an anesthesiologist, and boy, his talk was great. So Matt is from the Bay Area, and he is an anesthesiologist that was part of a very busy orthopedic surgical center. And I think his quote was the following: they were hugely overdoing surgeries. Why? The orthopedic surgeons were overdoing surgeries on people who had partial tears because they were getting a fee, a facility fee. And that facility fee could be up to $20,000. So naturally, there's an incentive to do surgeries. Well, Matt Cook actually left his job because they were trying to push him to do surgery on people who were shaky. Why? Because they made a lot of money. And what he realized is that orthopedic surgery, his quote, orthopedic surgery is not as effective as they say it is. And he began to talk about his relationship with Craig Conover, understanding peptides. So the takeaway from Dr. Cook's lecture, and there were a lot of takeaways, but I'm running out of time here. Jonathan's on. So I'm running out of time here. Because I'm running out of time, I want to talk about his peptide stacks. These include things like growth hormone releasing hormones like tesamorel and CGC and ipamorel. They also include BPC 157, which Dr. Prastana said there's a lot of hullabaloo about the worry of BPC 157 causing new blood vessel growth to tumors. Well, in preliminary studies, BPC 157 was actually found to regulate and reduce blood vessel growth in melanoma models. So maybe we're talking a smarter peptide than we think, right? And so a lot of research has to be done here for us to fully understand what all of these peptides do. But the most important takeaway from Dr. Cook's lecture, I think there were a lot of them, but this is the important ones. The immune system governs healing of musculoskeletal injuries. I'm going to say that again. The immune system governs musculoskeletal injury healing. If your immune system is messed up, you will not heal well. So you have to focus on immune cells in regulating healing in the musculoskeletal system. And that's some of the peptides that he talked about, including things like thymosin alpha 1 and GHK copper. So I think it's very, very, very important. Next up, all right, third lecture. I know I'm running out of time here because they're going to go right back at it. The third lecture was from Saranya Wiles. Dr. Wiles is a researcher and a dermatologist at the Mayo Clinic, where her first quote, which blew me away, was, I have to admit, I have minimal to no experience using GHK copper for dermatology. I'm going to say that again. One of the leading skin researchers at the Mayo Clinic has no experience using GHK copper. Well, GHK copper is used by tons of different other dermatologists without research experience. And she revealed that there's not a lot of good research out there on GHK copper long term. She believes that to use GHK copper, you need to use at least a 12-week minimum of it. Why? Because our cells cycle. The epidermal cells are there for 30 days and then gone. So because of that, we need to, when we're trying to look at the epidermis, when we're trying to look at the skin, we're trying to look at the dermis and the hypodermis, which is where your subcutaneous fat is, we have to give it time. We have to allow things work. Her second point is very important. Not all collagen is good for you. So the hullabaloo about collagen peptides may be overdone. Maybe you just need protein. And in fact, in a lot of the collagen-based studies, they didn't have an arm that just was increased protein. And another thing she said is be careful when you go and look at whether a peptide is going to be good, and all they do is show you photos of how the skin changed. Well, guess what? We all know this from podcasts. Lighting matters. Lighting is everything. Lighting can fake out the effect of the peptide, including hydration. Hydration can fake out the peptide. So it's very tough to show that a peptide or collagen peptides will work without looking at the skin itself. Number three important point that she delivered here is the following. Collagen peptides that are creams are too big to go transdermally. It reminds me of the issues with NAD and infusions. Well, there may be more to this than just having to go into the skin. Maybe there's more issues topically with collagen. I think about that with high hyaluronic acid and how it reduces inflammation. The next thing she said is oral collagen peptides. There's next to no study showing that those oral collagen peptides will magically make it to the skin. So I think those are very important. And her last takeaway, which I'm going to close up the morning session with, is the following. And goes to my daughters. It goes to everyone out there, but especially my kids that are running through Sephora. You do not need a 20-step skincare plan. Marketing is driving this. Marketing is driving this. You do not need a 20-step skincare plan. Instead, you need to think about the chronobiology of your skin. In the morning and in the day, it's focused on defending from assaults. And in the evening, it's focused on healing. What she didn't talk about, which I was disappointed in, because in Cannes, we had great talks about this, how important the mitochondria is. Again, Dr. Weil studies senescence in skin. What's the biggest driver of senescence? Your mitochondria in the skin. And if you're depriving the skin of sunlight or exposing it massively to blue light, even flicker, you're harming the mitochondria. You're increasing the risk of senescence. And I'm really surprised that Dr. Wiles was not studying that. So, big takeaway, plain and simple. Peptides are here. Peptides are the future. We need more studies. We need more databases, but there are already FDA approved peptides you can be using today. Those are tesamorelin. Those are GLP-1s. And now SS31, which we haven't talked about, but I'm sure we will talk about this in the afternoon sessions, or maybe even the session with Dr. Yurth. So again, this is Dr. Murphy, the Longevity Insider. I'm wrapping up my live stream. Today is October 4th. It's 11:18. Sessions are going to start again. Stay tuned, and I'll cover the next sessions. Here's to a life well lived.